Good. Okay, we're going to call our meeting to order. Again, I'll say an invocation, and then again, we will adopt the agenda. Father, we thank you for this day. We thank you for the many blessings that you bestow upon us. We ask for your wisdom and guidance as we go through our meeting. In your name we pray. Amen. Okay, again, first of all, I do want to say thank you all for being flexible enough to readjust your schedules to change the date for this meeting. So thank you guys very much for that. May I have a motion to adopt the agenda?
This is Steve Morris. I move adoption of the agenda as presented.
Adopt the agenda. Thank you very much, Steve. May I get a second?
This is Mark. I'll
Steve
second.
Morris. I move adoption
Thank you very much,
of
Mark.
the
I will
agenda
have to do
as
my
presented.
roll call, starting with Chris Bowe. All in favor? Second. Chris?
This is Mark. I'll
Aye.
Dr. Dana?
Aye.
Dr. Hagler?
Aye.
Dr. Pons?
Aye.
Ron Kincaid?
Aye.
Steve Morris? Mark Fitz?
yes.
And myself, James Mack. Is Dr. Buckwill on yet? Okay, thank you very much. All right, thank you very much for that. Also, may I get a motion to adopt the minutes from our November the 10th meeting?
So moved.
Okay, that was Tom Kincaid?
Yes.
Okay, and may I get a second?
This is Mark. Second.
Thank you very much, Mark. All right, and again, the motion is going, I make the roll call again. All in favor, Chris Bowe?
Aye.
Dr. Hagler?
Aye.
Dr. Dela?
Aye.
Dr. Pond?
Aye.
Tom Kincaid?
Aye.
Steve Morris? Mark Spitz, sir?
Aye. Aye.
And myself, James Mack. Okay, thank you very much. The motion carries as far as the approval of the minutes and the adoption of the agenda. So we will now have the report starting with Sue Yates.
Hey, good evening, board members. I'm going to talk about the three financial reports here. The first one is the summary report, which shows us kind of on an accrual basis where we look like we're going to end up at the end. The second report that you have, if you could go to the next page, is where we look at it more on an actual basis to the actual cash come in versus expenses going out. And the third report that I want to talk about just a little bit is the snapshot. Dental is still red. They're coming along. One of the dentists came back in early January from maternity leave. The expenses and the revenues are coming more and more in line, and we've also hired another dentist. We do know that we're expecting to get more money in for our vaccination clinics and the efforts there that we've been doing. So the funds that have been coming in for our response efforts has really helped CHA be able to move forward and complete a lot of our objectives. So, does anyone have any questions at this time?
I just have a quick question, Sue. This is Mark.
Sure.
Pardon my ignorance on this, but your budget numbers are for the year. Is that correct?
Yes.
So to the extent that we are below 50%, we're a little bit below where we would want to be. Is that?
Yes, and a lot of those have to do with some of the programs cannot complete all their objectives because they need to be in person, and we're working with the program directors and the funders to let them know where we're at. Also, a lot of the employees have been redirected from their assignments to COVID, and so those funds are covering that. The main thing that I'm looking at this kind of environment at this juncture is kind of seeing how in line the two numbers are.
Okay, thank you.
Any other questions? Okay, if not, we will move to the next set of reports, and that will be coming from Dr. Steve Cathcart, will be the employee separation report and the customer service survey report.
Hey, good evening, everybody. Hello, can y'all hear me?
Yep.
Yes.
Okay. I'm making
Good
sure.
evening.
Okay, so for the employee separations, we had the total is the total percentage of turnover is I think it's 1.7%. So we had we had four people that were separated from employment. Hold on, y'all. I'm sorry. I'm just all over the place. Give me 1 second. Give me 1 second. I do not have it in front of me, and I'm guessing. I'm sorry. Give me 1 minute. Thank you, Diane. Diane ran it over here to me. Thank you. So I'm sorry. I'm all over the place. So the total is 1.26%. We had 8 total separations. Three of the separations were in the 90 days probation, and then 1 was a retirement, so those didn't count. So does anybody have any questions on those? All right.
Were the ones that were in the 90-day probationary period, were those quits or terminations?
Those were resignations. Those were quits.
Resignation.
Yes.
Okay. Any learnings to come from that in terms of recruitment?
Well, I would say 2 of those folks may have had some unrealistic expectations of what the job was when they got hired. So I would say at least 2 of those folks had some unrealistic expectations. Not necessarily due to anything that CHA did in their recruiting process or interview process.
Okay, thanks.
Mm-hmm. You're welcome. And then the customer survey is gone from the customer service survey report. The average for quarter 1 was 96.6. The average for quarter 2 was 96.9. So very little change there, but we're still meeting our metric.
Any questions on the customer service?
I'm sorry.
I was just asking, were there any questions?
Yes, I'm sorry, I couldn't hear it. Yeah, do you guys have any questions on that? Does anyone have any questions? I would add that you'll be seeing some internal customer service survey results shortly. So.
Okay. All right. Thank you very much, Dr. Cathcart. And our next set of reports will be coming from Tamara, and I'm not going to mess up your last name.
Staylor, Tamara Staylor. Hi, good evening, everyone. Good to see you. I know I get to see some of you on a weekly basis, but tonight I'm going to talk to you a little bit about the strategic plan for the COVID department. So I am the manager of our COVID-19 department, and we worked through this back in November. A lot has happened since then. So it's a good thing that this is a work in progress and a working living document. So we're going to start with talking about some goals that we set up around data. So our first goal that we talked about was to create a public-facing data set that we could use to inform the community and utilize for decision making, and then also to use an equity lens for our data collection, analysis, and dissemination. If you'll go to the next, goes into a little bit of detail about the objectives that we discussed. Some of this we've been doing for a while, and it has evolved over time as the state has presented more and more on their dashboards that are more related at the local level. But the COVID-19 data, we're wanting to use to figure out what's relevant to our stakeholders. We utilize this with our school systems, with our local leaders weekly, and how we can use that information to get the information out to the public, especially around testing as it was, and now more in the area of vaccine. We also prioritized looking at some GIS software so that we could utilize that for live heat maps and being able to purchase other software to analyze data, again, in our efforts around vaccine and testing. If you'll go to the next one. Goal 2 was our equity lens. We are utilizing a system called CCTO to do our contact tracing. We're able to pull different information out of this that impacts the public and identifying hotspots and areas that we need to focus on. One thing that we are going to be moving towards implementing is antigen testing in the schools. That will give information around that school-age children, which there's just not a lot of research around yet, and still coming. So that's all about data. The next area for internal and external practices and programs, our goal that we established was to ensure equitable access to services and programs. If you'll go down, objectives there were around our call center. Our call center purpose has ebbed and flowed a lot over the last few months. Everything from tracking call trends, what people are calling in for, to also helping establish areas for testing and vaccinations. So this is constantly changing right now. And then also another objective that we looked at was related to testing in marginalized communities. We did do some testing events, and of course, now our efforts are moving more towards vaccination. You can continue to go. This next area had to do with agency capacity, culture, and practices to achieve excellence. Our department discussed a goal of culture of quality improvement and continuing to move our department forward. And then also what kinds of capacity we had to include alternative service delivery and outreach models. And so objectives around this was to discuss training of staff. This department has seen a lot of staffing changes, pulling from areas of need, utilizing school nurses, dental, and how do we make sure that we're utilizing skill sets in the best way, and making sure that the job performance as a department for the public is where it should be. And then the next is community education. We have done all different kinds of things around this, and we'll continue to do that, but especially with our nursing homes. We do have Ozma Warch, who is leading a group within the COVID department where they are actually going into nursing homes and facilities and helping reach out to them around their infection control and prevention. And they're just working and being a wonderful liaison and between the COVID department and the facilities and what their needs are, and focusing more on facilities that the strike teams with the state are not focusing on. Any questions around the COVID-19 department strategic plans? All right. Thank you.
Okay, thank you very much, Ms. Baker. Okay, our next agenda item is coming from Betty Foe, and it's our strategic plan for 2020 through 2025.
Hi, good evening, everyone. I am excited to be bringing you the final strategic plan report. As you all recall, in August, you approved the strategic priorities, which were some of the 4 priorities that Tamara just depicted. And then in October was the goals, which were some of the goals that were reviewed. Each department has gone through their strategic planning process. Many departments are on their second or third round of strategic planning. The document that you just saw from Tamara is what we call a specific department strategic plan, and it is a living document. Over the course of 5 years, we will be coming to you to just update you on some of our strategic priorities. Today's report that I bring you is the final strategic plan for the agency. What we are asking is that you review it. I also would like to acknowledge such a great team that we had for strategic planning. If you guys can scroll down to the acknowledgements for me, please. We had a data team, an industry analysis team, a SWOT team, which is our strengths, weakness, opportunities, and threats team, and a report team. All these people served in various capacities in order to put together this plan and for us to have a 26-page plan to present to you today. The strategic priorities are outlined along with our guiding principles, our executive summary, and you can just scroll down a little bit. Perfect. Why we do strategic planning for accreditation needs. Continue scrolling. And our 10 essential services. As you notice, we are including equity in all the work we do, and that is a part of the 10 essential services for public health services. And you scroll down a little bit. One of the things that we would like you to pay attention to specifically is keep on scrolling, our strategic priorities, just to review them and to review the goals that are associated with it. In February, we'll come back and ask you if there are any questions or comments or changes that need to be made to our strategic plan, and just to continue to review it. I see Dr. Hagler, your hand is up.
Yeah, I was reading through this and I guess just language change. So in the chief health strategist page, in the lead-in, you comment about collaborators, but then in the various other areas, you use competitors. I would tell you, and I guess I won't speak for Chris on this call, that we certainly don't view the health department as our competitor. And it shifts because you use the word collaborators up top and then it shifts to competitors. And I'm not really clear. Maybe you compete with private practices, but I don't think you compete with us.
No, it should say collaborators all throughout. So that might be a misread on our behalf, but it is collaborators. Industry analysis is usually done based on competitors, but what we see ourselves as is a convener with our partners to collaborate.
All right. Well, I think it's like I thought I saw that in the atrium one, but I know clearly it says in the physician practices it's considered competition.
Dan, thank you for bringing that up, Mrs. Bonnie, and I agree. When I first read our CHA and saw the language of competitor, I also raised questions because I've not included that language in health assessments that I've done for the past 10 years in other locations. And I think as a public health chief health strategist, that term wouldn't even make sense. Our role is to assess what the needs are in the community and then to arrive at the programs and the policies that will improve the health of the community. So if something is some role is already served by another entity, that doesn't make them a competitor. That makes them a collaborator. And so I've been asking too that we change that language and move away from that concept of, you know, a market analysis of competition to it's more about assessing our ability to collaborate and partner.
Are there any other questions? So what I will do is I will make sure that Miss Diane, I will send you an updated version in regards to the language. I think we have tweaked it since then because Dr. Coyle and I did have a discussion about what a chief health strategist is and what that looks like for CHA collaborating across with our partners. So I will send that and hopefully you guys will receive that shortly.
Okay. Any other questions or comments on the strategic plan? Okay, if there are no other questions or comments. Okay, Bonnie, we'll move to your area, which would be the director's report.
So good evening, everyone. As you can imagine, our agency has been very, very engaged in the COVID response. Yet, when you look at my report for the months of December and January, you'll see that we still have managed to do quite a bit of work in some of our other core public health areas. Just to point out a couple of those accomplishments from the report that you have in front of you for awards and recognitions. Dr. Suda was awarded the 11th annual Ann Bacchitis Champion for Children Award. I sent that out to let you all know last month when that occurred. And in addition to that, we've had several staff who are advancing education and completing programs that will bring additional skills to our agency. Marcus Misenheimer and Danielle Cook, who are in our communicable disease section, are completing the coursework from UNC Chapel Hill so that they can become STD nurse clinicians to be able to expand our access to those services for our populations. And 3 of our WIC nutritionists, Monica Hernandez, Holly Reinhart, and Anna Fadani, have completed the North Carolina Lactation Education Program to improve our services around helping moms to adopt successful breastfeeding practices. For human resources, I'm pleased to say that we have posted our equity coordinator position. We had held on that for a few months while we were waiting to get our budget aligned more effectively, but we have moved forward on that as we are feeling more comfortable there. For finance and grants, I'd like to take a second and introduce Sarah Bingo, who is here in the, why don't you say hi so
Hello.
that the camera to you.
Hi, thank you, Dr. Coyle.
Sarah is our development officer here at CHA, and she has been working very hard. In November, December alone, she submitted 8 grants totaling over $1 million in requests. And in that same period of time, we got over $800,000 in grants, one for minority diabetes prevention, another for COVID response and some for environmental health. We also secured an opportunity to provide rapid antigen testing in the schools. It didn't come with any cash, but it came with thousands of rapid tests that will allow us to more effectively identify students who may be infected quickly before we end up with a cluster or additional spread. For clinical services, we've been talking a lot about dental the past couple of months, and you saw again, we are still categorizing as in the red, but we are moving in the right direction. We are back to 5 dentists. We had some that were out with leave and maternity leave and illness and that, but we are, everyone is back. We are fully staffed with 5 dentists. We also, I'm happy to let you all know, have no dental employees on furlough any longer. We have dealt with 2 furloughs throughout the past year because of the how hard hit dental was from the COVID pandemic, but we are back up and running. The one service that we do not have working again is our community portable dental program because of the schools being in generally a virtual environment. But we are using that portable dental equipment to serve more individuals by setting up in the WIC offices. So we are looking forward to being able to get that program back up and running. I need to give a huge shout out to our school health program. Barbara Shepard and the whole team, all of the nurses, they have stepped up in a major way through this COVID pandemic to help us with our staffing, with our vaccine clinics and in our EOC, and we could not have done it without them, and we're a little concerned about how we are going to do without them now that they are returning to their schools. Another thing the school nurses have been working on is every year, I'm sure you're all aware that for children to stay in school, they must be fully immunized. And this year, we've had this year we've had a few more students who are not fully immunized as of our deadline, which was extended till December 30th. We had 60 students in Kannapolis City Schools and over 600 in Cabarrus County Schools, but the nurses are working very diligently to reach those students and families and assure we get them connected to their immunizations so that they can be in school. The COVID, no highlights on COVID since we had that as our presentation tonight. And also for the Cabarrus Public Health Interest, that board meeting will be held tonight. And just as a reminder, our Board of Health here serves also as the board for the Cabarrus Public Health Interest, and we will be holding that meeting immediately following this Board of Health meeting. For our healthy living programs, our minority diabetes prevention program is looking for referrals to our programs. They've partnered with an entity in Charlotte, a food pharmacy, to conduct screenings at their locations. And if any of you have other ideas about agencies and community groups that we might be able to reach out to get more participants engaged, we would appreciate any connections you could make. We mentioned at our last Board of Health meeting that we had some open positions in environmental health. Those remain unfilled, and we are working diligently to get them filled. Our on-site wastewater program is only 2 weeks out on appointments now. We closed that gap in how long it was taking us to respond to some of those appointments. Just like every other program, we do have challenges of staff being quarantined and isolated because of being close contacts or actually having COVID. And so in addition to the strain of responding to COVID, we at times have reduced staffing levels as a result. Our work on our Healthy Cabarrus initiative has had some delays as we've put so much time and energy into the COVID response. But there are planning retreats on the schedules to address our 3 new priority areas in this cycle: mental health, housing, and early education. In terms of marketing, Marcella Beam handles both Healthy Cabarrus and marketing, and she and Tracy have been doing a tremendous job of handling all of the marketing for our COVID-19 program. That in and of itself is a full-time job anymore, and yet they've been stepping up and making sure that we are really keeping things well promoted, so I thank them for that. For some of our performance and quality improvement efforts, Betty Foe has really been doing great work at getting scorecards up and running in all of our programs. We will continue to show you those every month as part of our board meetings as we move towards more measurable objectives, measurable outcomes in all of our programs. And as you know from tonight, she also presented the completed strategic plan for you to review. We also have a committee here in CHA looking at formalizing our intern process in efforts to move towards an academic health department certification, so that we can work with all of our local and not so local colleges to provide educational experiences for interns that are also win-win, and that they provide additional services and help for us. In terms of Board of Health activities, we've had 3 of the Board of Health members come and do walkabouts with me to thank the staff for all of their hard work. I thank the 3 of you that have already participated, and I'll be sending an email out in the next week asking if some of the others of you might have time in the next few months to come and do that. The staff really love meeting you all, getting a chance to talk to you, and have really appreciated when you have all come around. I also want to call out and acknowledge Dr. Pons, who has come already and volunteered at 2 of our vaccine clinics, and she's coming 2 more times at the end of this week when she gets off of her long sleepless shift over there at the hospital. And the staff loved working with her and getting to know her more, and we really appreciate her service commitment to our community. And then lastly, on the report, you'll see that there are a couple of now BOA sessions coming up I wanted to bring to your attention in case any of you thought they might be helpful or interesting for you. A town hall on the core competencies for public health, and then the spring symposium will be in March, and some of you might want to join in. That will again be virtual. We will also present our budget to the county on April 15th, and Mr. Mack will be joining myself and Sue Yates for that. I've also included our progress on the fiscal year 21 goals, since we are now at the 6-month mark. So these are the goals I presented to you back in August, focusing on 4 areas that as an agency, we really wanted to get everyone more familiar with and focused on the Public Health 3.0 model, including getting the Board of Health engaged in more of our activities, and then focusing on leadership development as we realize that some of our management staff could benefit from additional leadership training and skills. Data and metrics, as I think it's so important that we move towards an outcomes-based approach, that all of our programs are in a unified fashion, developing and tracking outcomes that show truly whether or not we are making progress and improving the health of our communities. And then finally, our health equity focus as we look to make sure that all of the members of our communities, regardless of race, sex, gender identity, poverty levels, that all of our community members have the same access to health services and achieving a state of health. So for what you'll see here is we are, for each of our goal areas with board engagement, we've either marked the individual goals as completed, on target if we're making good progress and we're very sure we will meet the deadlines that we've established, and an X in off target if we're a little behind. And you'll see that in general, we are either completing or on target for most of our goals. And I think that's a real accomplishment considering we have had so many distractions, if you will, as we have continued to respond to the COVID pandemic. And so while we've fallen behind on a couple of our targets, I believe that we can even pull those back on as we move through the year and hopefully adjust to managing both COVID vaccine clinics and all of our testing and our EOC work. So under leadership, you'll see that I have us checked off as off target on both of those because our deadlines to have our leadership program in place and education of all of our staff on Public Health 3.0 has passed. And with the past 2-3 months being so focused on COVID, we didn't think nor want to, that we didn't think our staff could handle any more trainings, and we did not want to overtax them when they're already working really around the clock. Our data and metrics are moving along nicely. We're bringing every month, we're bringing one of our programs to the Board of Health to show you the metrics that we are developing, and we're still looking to fill out some of those report cards, but I think we're on target to meet our deadline of having all report cards up and running by the end of this year. And then finally, under health equity, again, I think we're on target with much of what we have proposed. As you can see, the couple of areas where we're off target are again on activities we wanted to have done in the next month or two around educating the community and identifying funding streams. And with us being so focused on COVID, that set us back a little bit. But I'm feeling pretty confident that we will meet the vast majority of those metrics. And again, I want to thank the leadership team and the management team for going above and beyond these past couple of months, not only trying to respond to COVID, but also helping develop a new culture and a new approach and focus on these goals. So with that, are there any questions on the report or the progress report for FY21?
I suspect I will speak for most of the board members, if not all, that under the shadow of a pandemic, even if it weren't, this would be a very impressive set of goals and accomplishments that are not just focused on the immediate areas of responsibility, but are very much involved in improvements and in making changes and in taking the what is already a highly recognized health department and just improving it in ways that are really impressive, really admirable. And I think I saw something that Laura Pons wrote today. I can't say how proud I am to be a part of this and to lend support and energy to what you're doing. I just think, Bonnie, your leadership in this, but the entire staff is extraordinary. And I'm sure I speak for the whole community as well in appreciating your efforts and your accomplishments.
Thanks, Mark. This team is an amazing team here. There are such committed workers. We have really been working 6-7 days a week for the past month or two, and everyone just keeps rising to the occasion and doing whatever it takes and working quickly. As you know, that we've been challenged by the state saying, okay, here's the plan, and then 3 days later saying, nope, now here's the plan. Wait, no, 3 days later, no, we're changing the plan again. And you can imagine the stress and the wrenches that throws into your planning efforts when your target keeps changing. And yet this team just keeps showing up every day and with a smile on its face and saying, we can do this. So this is the team you want when we're trying to tackle a pandemic.
Yeah, I also want to say, I guess in agreement with Mark, just reading some of the comments and getting some of the feedback that we've been getting as far as from the work that CHA is doing. We certainly appreciate all the hard work and the efforts that is being put forth in the community, as well as working with the COVID situation that we're having to deal with right now. So thank you guys again very much for all that you're doing.
Yeah, I've shared a couple of responses. I don't want to inundate you with the emails that we're getting inundated with, but it's a great way to be inundated. We are getting calls and emails from people in the community who are just so appreciative and awed at how well the team is moving them through the vaccine clinics in timely manners, and saying, everyone's friendly and helpful, and I see it when I'm out there at the clinics. Everyone is responding with what I would call 5-star customer service to everybody. So
Any other questions or comments from the health director's report? Okay, as well as the goal progress. So if not, we will move to our next agenda item, which will be Sue Yates and the budget revisions.
Yes, tonight you have the budget revisions for the January meeting. The majority of the revisions are moving funds to align the budget with what's actually changing in the grants, depending on how much they're able to actually get out and interact with the participants. We've had to change some of those around, as well as the additional funding that we have received for the COVID response. Are there any questions?
Okay, are there any questions? Okay, if not, could I get a motion to accept the consent agenda?
So moved.
Okay, Tom Kincaid, may I get a second?
It's Laura Pons, I'll second.
Thank you very much. Okay, we have a first and second, and again, all in favor, I'll read my list again. Chris Bowe?
Yes, sir.
Okay, Dr. Buckwell? I thought I saw him. Dr. Daly?
He put yes in the chat.
Thank you, Dr. Daly.
Yes.
Dr. Hazer?
Yes.
Dr. Pond?
Yes.
Tom Kincaid?
Yes.
Steve still here? Okay, Mark Spitzer? Mark still here?
I think they stepped away.
Okay, myself, all right. I think Steve had to leave earlier, and I also, yes. Okay, so the motion will carry, and Sue, if you would move to your next agenda item, which will be the financial policy.
Yes, tonight I'm only bringing one policy. It is the cell phone policy. This year we did split it up between an IT policy as well as a finance policy. The IT policy has been changed to include things like CHA business should not be conducted via text. And if it is, then your text messages need to be saved and not deleted. So a couple of items around there. And then the finance policy has more language regarding what you're expected to do if you get a cell phone stipend and what that covers. So those That is the only policy that I'm bringing tonight. Is there any questions regarding the cell phone policy and the changes?
Okay, if there are no questions, may I get a motion to accept the revisions to the cell phone policy?
This is
So-
Kim, motion to accept.
I'm sorry, who was that?
Yes, Stan Hagler, second.
Okay, who's the first?
Kim, Taylor,
Tim, okay, thank you very much. All right, again, all in favor, I'll go down my list again. Chris Bowe,
Aye.
Dr. Taylor,
aye.
Dr. Hager,
Aye.
Dr. Barnes,
Aye.
Tom Kincaid,
Aye.
Mark Spitz,
Aye.
and myself, aye. Okay, motion carries, so thank you very much for that. Our next agenda item would be the announcements. And the only announcement that I had was just basically just to continue to thank everyone for the job that they're doing through the situation that we're going through with the COVID. Also to make the announcement, our next meeting will be February the 9th. So again, those of you that can make sure that's on your calendar so we can make sure we have a quorum for that meeting. Any other announcements?
James, this must have gotten missed on the agenda. In addition to the COVID strategic plan, we were going to briefly show you all the update of the data for COVID.
Okay, cool.
So if I can, I'll try to move through this pretty quickly for the data here. So you see here, we're up to over 14,000 cases in the county through about mid-January. So you see, you're back around November, really started on that exponential uphill climb, total number of cases. We are now at the point where we are getting about 1,000 cases a week coming in, and that has been now for a couple of weeks. You'll see that it looks like it's turning down dramatically here, but I caution anyone to interpret that as a definite downward trend, because when we get close to the date that we are, when we're looking at the trends as it gets close to the date we're actually at, there's test results that haven't come in yet, and that. So, but we have seen a sort of leveling off. So I am hopeful that maybe we have finally reached the apex and are starting to level off and maybe come back down the other side. Certainly this past week was probably the main, that's when you're going to have seen a lot of the effect from all of the socializing that went on through the holidays at Christmas time. So our percent positivity rate continues to be higher than we would like to see it. We were at 16.4% this past week. The good news was, for the first time in a little while, it finally turned down. We had been all the way up to 18% week before, and have been climbing relatively steadily for quite a number of weeks. So that was the first time we've seen a downturn in a bit of time. So we're hoping that that will continue down, but as you all know, 16% is a very high positivity rate. We really want to see that under 10% and really down around 5 to 7% before we feel comfortable and in that we've got mitigation strategies under control. Here you see the hospitalizations at our local hospital. This is all hospitalizations for COVID, not just county residents. So you see again, starting in December, we really started getting a rather large jump in cases that are in the hospital, and it does seem to now be leveling out, but that higher rate is certainly challenging for healthcare systems to manage. And so if you all remember that both CHA and the state developed this county alert system to identify whether counties are doing well, which would make them green, or if they are really having widespread infection rates that are really challenging the county, and that would be a red zone county. And right now, the three metrics that are used to measure this are how many cases per 100,000 people you have, whether your percent positivity is above 10%, and how much the hospital is impacted by the COVID spread. And so Cabarrus County, like most other counties in North Carolina, is a red zone county. We've been in the red zone for about at least 6 weeks. And unfortunately continues to stay firmly planted there based on our rate, our positivity, our percent positivity, and the impact on the hospitals. So we at CHA had developed this chart to put out recommendations for what we think our communities should be doing depending on the zone that they are in. And in the red zone, we are really encouraging that essential employees only are reporting to work. Others should be working virtually. There should be very limited services on site. There shouldn't really be indoor dining. We should stick with takeout only. And again, people should be limiting their contact. They should really not be socializing with folks that do not live in the household with them, and that we would encourage virtual environments for schools when we are in the red zone. So those, again, almost there's only a handful of counties right now in North Carolina that are not sitting in the red zone. So we are a very impacted state right now. This just shows you we've been working very closely with the schools, and we really appreciate the tremendous partnership we have to collaborate on trying to make sure we keep spread at its minimum in the schools. The schools have been very active helping us with investigations and contact tracing. And here you can see that the number of cases, both amongst the blue line is 5 to 17-year-olds, and the orange line is 18-year-olds. We broke that out because some 18-year-olds might actually be college students and not in high school anymore. So you can see that we have that bit of a bump that would sort of align with the Thanksgiving holidays, and then another bump that probably aligns with the Christmas holidays, but in general have been working closely with the schools to minimize the number of students who are impacted. The state has also made this a priority group for case investigation so that we can prevent clusters and outbreaks in the schools. So the reopening plans are that Cabarrus School District will be staying in Plan C, which is virtual learning until February 15th, and the Cabarrus School District has elected to go to Plan B starting today, which is a hybrid model where they are students are split. 50% of the school of the students come to school 2 days a week, and then the other 50% come the other 2 days, and then Fridays is a virtual learning day. And as I mentioned, we are working on a project with the state and in partnership with the schools to provide rapid antigen testing so that we can quickly identify cases and do contact tracing and get people quarantined and isolated so that we do not create so that we don't have outbreaks and clusters in the schools. So it's not great news that we remain in the red zone and we have widespread community infections, but the good news is we have a vaccine, finally 2 vaccines as a matter of fact, both Pfizer and Moderna. And we've been working with the state. This was what I was referencing before, where the plans continue to change. The state has changed on several occasions now what they view as the priority groups for vaccination, and we have continued to adjust our plans and strategies to continue to provide vaccines to those at highest risk. Right now, we are working under a prioritization plan that has 5 groups. The group 1 is healthcare workers and long-term care staff and residents, and group 2 is older adults greater than age 65. And those are what we call active groups, meaning those are the individuals who can be getting vaccines right now. Groups yet to be eligible for vaccine are then group 3, frontline essential workers, which includes like public safety, our court system, the county social workers, frontline folks who are engaging with the public on a daily basis. Then we have group 4, which is adults who are at high risk either for exposure or increased risk of severe illness, generally because they have a number of chronic diseases. And then lastly, will be open to everyone else. So again, right now, we are actively vaccinating groups 1 and 2. You'll see on the next slide that we have, just in our first few weeks, we have already administered 4,294 vaccines, and I don't think that includes the vaccines given today, which is another 700 and some, so we're probably at 5,000 vaccines at this point. We will be administering about 2,000 more by the end of this week, as we have clinics scheduled Friday and Saturday also. On the left, you'll see a chart that shows you how our whole state is doing at administering first doses and then the second doses. And you'll see that according to the state website, we have had 344,000 people vaccinated with their first dose, and about 60,000 have completed it. When you look at Cabarrus County, you can see that the records show that we've had about 6,100 with first dose and about 773 completed. I can tell you that this is an underestimate because the state and the federal government is monitoring the CVMS system, which is the data entry system that we have for the vaccines, and they're only counting a vaccine as provided if it has gotten into CVMS. We've had some struggles with the efficiency of CVMS and being able to get the data in. It's time consuming, it's tedious, and there have been issues with the state, not for us, but for the state, getting it up and running. And so we know that not all doses are recorded there. So that number is a low estimate for our county. Just wanted to point out a couple of things. With our staff out doing the clinics multiple times a week, and now we've got volunteers coming too, we had started to provide lunch for everyone because there just wasn't the time and ability to leave and go get lunch and come back. And so we did that for a week or two, and we realized that would break our budget if we continued. So we reached out to community agencies, businesses, and individuals and asked if they would consider sponsoring lunch at these clinics. And I'm proud to say that we have had so many entities step forward and volunteer to cover one lunch for us. Diane Berry has been doing a great job of negotiating with the food entities to get a really good rate so that we're being able to provide lunch for 80 plus people for about $250 per lunch. And this is the picture that shows you the Kannapolis Rotary sponsored lunch. I think that was yesterday last week for our teams, and Subway partnered with us to give us a good rate on that, and Kannapolis is covering that cost. And then you will also see that I think it was today we had an additional, the city of Kannapolis helped provide the funding for today. So if any of you are associated with businesses who might be willing to do this, or can give us, connect us with folks, the staff and the volunteers appreciate this so much. And some of the folks are even coming out to thank the staff while they're working, and the staff really appreciate that too, to see that the whole county is behind them as we take on this pandemic. And so we've really been growing our volunteer opportunities at the clinics. Right now we are scheduled to hold them every Tuesday, Friday, and Saturday, and you see the roles that we have that we are looking for folks to help with. And I put out an open invite to any of you if you would like to come and either volunteer or just come out, and Aaron and I can show you around and let you see the operation. It's very impressive to see the efficiencies that we have been able to achieve with moving people through.
I'll be there Friday.
Friday?
Friday.
And here's Mayor Hinnant, who had folks take his picture as he got his vaccine recently, and then he posted it right on the social media channels to help us encourage our community to get out and get vaccinated. We would like to strive to achieve getting 80% of our county vaccinated. That is going to be a challenge because there are some folks who, as you know, this has become, unfortunately, a sort of divisive issue, and some folks may not choose to get vaccinated. The more we have leaders and community members helping us promote this, how safe this is, how important this is, the better. So as you also get your vaccines, if you're inclined to do so, and you want to post a picture like the mayor did, and help get the word out that everyone should get out there and get vaccinated, that will really help us with our message. So, do you have any questions about the that COVID update? Any comments, recommendations, concerns?
Bonnie, it's Laura Pons. Do we have any sense of how many, like what percentage of people getting the vaccine are from Cabarrus County and are from outside the county? Because people are coming from all over the state and other states to get their vaccines here because it's the most efficient process anywhere.
Yeah, so I'll let Erin jump in because she just shared some interesting statistics with me today, and I'm going to make sure I don't mess them up. But the state has made it clear that we cannot turn anyone away, not even if they come from out of state, because this is federal vaccine, and so everyone can be vaccinated. But, you know, our focus is our county, and so, you know, it's challenging. But Erin, do you want to jump in and provide your perspective and insight?
Yeah, good evening, everyone. Happy New Year. I hope your 2021 is off to a healthy and safe start. So as Dr. Coyle said, we've been really busy, and that has been an interesting data point for me to follow, Dr. Pons. And so as we've been watching appointments being made, it felt like we were seeing just this really kind of overwhelming amount of people from out of county. And when we really looked at it, it looks like it's between about 10 and 15% when we look at our large clinic. So right now our throughput is right at 800 doses per clinic. And we think that with a few more tweaks, we're going to probably land closer to between 900 and 1,000 per clinic. That being said, we had some capacity last night, and so we opened up our appointments around 7:30. We opened up 192 more slots, and when it closed, we ran that report, and 50% were Cabarrus County, and the other 50% were not. And so we had folks as far away from Wake County come to see us today. We've had a lot of out-of-state tags drive through, which Dr. Pons, I'm sure you've seen when you've come through. So we certainly are going to continue discussing, you know, how do we make sure not only are we taking care of those who come to the clinics and make appointments, but how are we really making sure we're taking care of our Cabarrus County friends and family first and foremost?
I don't think it's a bad thing that other people are coming in. I think, you know, that we do need to, I think that they need to take your process and just spread it all over the state, because other counties are doing nothing. And I mean, I'm shamelessly telling people, like, come on up here. I'm sorry, but it's, I might be responsible for those Wake County people. Anyway, yeah, I mean, your process is amazing. And I can't even, again, I sit down and I can't even speak highly enough of how it's going. And please don't give me credit for going. Honestly, it is so good for my mental health. The people in the cars I'll cry. They're so thankful.
Yeah.
It feels like we're finally doing something.
Hey,
Well,
Laura,
yeah.
this is Chris, and I would say Wow, thank you. And then secondly, to your earlier point, Bonnie, be proponents and advocates for the vaccine. I really don't care where they come from. Let's get shots in people's arms. We're in a near crisis moment right now with this impending peak. So every person you all vaccinate, I'm celebrating. So thank you very much, Aaron. I know it's yeoman's work, but I'll take them from wherever they come.
Yeah, and I'll echo Dr. Pons's emotions there. My parents are in their 70s, and so when the state opened up to 65 plus, it was that moment where you feel like you've worked so hard to keep them safe. And so I asked Bonnie, I said, I'm gonna ride through with them, and so I could be there with them in that moment, and it was a very neat experience. So, but great teamwork. Everybody's tired, but it is good for the mental health to see people coming through and a very positive reaction. So
I will tell you, it is counterpoint to a discussion that I had last night. My mother is 2 months from being 90 years old in the state of California. And twice she has had an appointment, and friends of hers have had the same experience. You go to the facility and they have run out of vaccine by the time you get there. So how absurd is that, and how horrible is that? And it's to our credit here that we're doing such a great job with a process that works. So hats off to you guys.
yeah. Well, we learned some key lessons on January the 6th. So apologies if you've got some frustrated individuals who waited for hours in line, but we committed to each other and to the community. We wouldn't do that again, and went to work before that day was even over to set up the appointment system that really is working very well at this point.
Great job. Great job. Okay. Any other comments or any other information? Well, if not, I will need a motion to adjourn our public health meeting.
So moved.
Okay, that was Mark, and may I get a second?
It's Laura,
May I get a
second. It's
Okay, is that Laura?
Yeah,
Dr. Pons? Okay, all in favor? I'll run down my list. Chris Bowe,
Aye, thank you very much.
Dr. Daylor,
Aye.
Dr. Hagler,
Aye.
Dr. Pons,
yes.
Dr. Kincaid,
Aye.
Mark Spitzer,
Aye.
myself. Thank you very much. We will adjourn our Public Health Authority meeting, and we will now go